Hello and welcome to all of our Gold viewers from around the world. I'm Kristen Schwartz, licensed midwife and one of the MCs here at Gold. And today I have back here with me Johanna Sargeant. Welcome back.
Hi, Kristen. So pleased to be here. I love working with you all at Gold. It's great.
So wonderful to have you back. You are part of our Gold Summer Learning Day here coming up 2025, just around the corner, basically a little bit over next week, I believe. And I can't wait for your presentation, which is titled Critical Details You Might Be Missing in Your Oral Assessment. And I want to talk to you about that in just a moment. Just briefly tell our viewers where you are in the world and just briefly about your background.
Yeah, sure. I am based in Switzerland. I'm originally Australian. I've been in Switzerland for 15 years now. And I run my own private practice here, mainly working with the English speaking population, which is very large in Zurich, where I am. And I am working together with a gynecologist and a postpartum psychologist, and there are a variety of pediatric dentists that work together with me as well. So currently thriving private practice and yeah, hopefully providing really great support for the women here.
That's absolutely amazing that you are able to work in such a, cooperative environment, right? It's not easy to
Hmm.
find care providers who are really on board and really working
Absolutely.
closely with IBCLCs and such. So that's like
Yeah,
the dream setting there.
absolutely. Yes. Yep.
So your talk this time for the Summer Learning Day is critical details you might be missing in your oral assessment. A very intriguing topic. And I want to say this is not just for newbies, right? Your topic is also for the seasoned IBCLCs and care providers out there because, this is somebody might be looking at this going, "Oh, I've been doing this for plenty of years now, I don't, I might not be missing anything here, but
Hmm.
there's always
Hmm.
something, right?" So talk to us a little bit what you hope to what you hope our viewers will take away from this presentation.
Yeah, sure. So I think one of the things for me is that, like, I go into every consultation presuming that I will be doing an oral assessment,
Hmm.
and I still have points where I have to catch myself and remind myself that even though I've been doing this for years now, that I have to remind myself that the parent that I'm working with, this is potentially the first time that this has happened for them.
Hmm.
So
Hmm.
I am very aware of the kind of language that I'm using in an oral assessment, very aware of um, the way that we can use an oral assessment for a lot more than just looking in a baby's mouth. So that's one aspect of what I'll be looking at. Um, the other thing is very much about kind of clues that we get before the oral assessment and then also during, but I'm focusing a lot on the before because I think that when I've seen other people at work doing oral assessments at the point where they've been doing enough that they're very confident with it,
Hmm.
that they often just kind of dive right in there and don't take that step back to firstly assess the situation, take a moment to see what are we noticing before we go immediately into the oral assessment. And I think
Mm,
that that's kind of the trap that we get into sometimes when we've been working a long time and we
right.
feel really confident that we do dive
Yeah.
in sometimes a little bit too quickly.
And let me ask you this, the before, I'm absolutely, this is absolutely fascinating what you said to really take a step back and look at the before diving into the oral assessment, take a breath and look at the whole overall situation.
Hmm.
That might be looking very differently depending on the setting. I can imagine if you going to a somebody's home and you get a totally different lens or view of the overall setting
Hmm.
than when a family comes to you into practice. Talk to me a little bit about how you observe the differences.
Yeah, sure. I think that I'm doing in my work now, I'm doing probably 80% in my practice and 20%
Hmm.
home visits. And what I see is that um, the parents in the practice are I think, very ready and open for me to do everything. Whereas
Mhm.
when I go into their homes, they already have their way of doing things. And it's very much more like I have to even more so pull myself back and sit back and direct everything for them to do, much more so than in the practice. In the practice, they're very much expecting me to go pick up their baby, take their
Mm.
baby, put the baby where I want them to go. And in the home, I'm very much like I expect them to do really actually part of the oral assessment themselves. And I'm going to be talking them through what they need to be doing and the kinds of things that we're looking for as well.
That's fascinating to me. You're absolutely right. Like if somebody is coming into practice, they already bring their baby and they kind of expect you to do it while in their home. This is their they're more confident. This is their surrounding, and you're more like the visitor, I would say, right?
Hmm, hmm,
Where you're coming in. But on the other hand, of course, it is important to always make the parent obviously, in charge of the parent is the expert on their baby, right? So how do you
hmm,
integrate that when they're coming into your practice and expect you to do everything?
hmm.
How do you integrate that into parent-centered care?
I think it is always about asking permission every time that we do everything. So if they are holding their baby, then I am never going to just go and take their baby off them to start doing something, right? And I think that hopefully most of us are in that situation where we're not doing that. But always explaining everything that we are doing before we do it, not just as we're doing it. So I'm
Mhm.
going to be asking permission to touch the baby's face, permission to go inside the baby's mouth, um, and tell them as I'm doing that what I expect to see and what I am going to do. I'm not just going to start touching the palate and then say, now I'm touching the palate. I'm going to say, what I'm going to do is go inside your baby's mouth and then I'm going to get up higher and explain as I'm going. And I think as soon
Mhm.
as the parents can see, um, have an expectation and a prediction, it also
Mhm.
helps with that stress level for them.
Yeah. Oh.
Uh, One thing also that I always say, and I really make it a priority, is that I am talking to the baby throughout, and I
Mm.
am always telling the baby at least once, ideally more than once, I will say to the baby, you are the boss, you tell me when you're done.
Yes.
And I
Hmm.
think as soon as the parents can hear me say that to their baby, then I can feel immediately like the anxiety level in the room goes down. So,
Oh, that's beautiful. Absolutely beautiful. So, and what would you say to, many IBCLCs are working very busy practices, hospitals, right? And
mhm.
they're pressed for times. What kind of brief tip do you have for them when it comes to this topic?
I would say that from my experience where I have a lot of people that have gone to the hospital IBCLCs, and they have this experience of maybe only having a 15, 20
Hmm.
minute slot, maybe even less. Um, and then when they're coming to me, I've got 90 minutes, like
Right.
60 to 90 minutes. So obviously a much bigger amount of time. Uh, the thing that I see is that nearly every time the oral assessment gets skipped over, is that
Mm.
the focus is always on positioning and attachment, always on comfort levels, on getting a deeper latch, and then just skipping the oral assessment. And I think that it's very frequent that people are saying this is the first time that anybody has felt my baby suck on their finger or looked in
Mm.
my baby's mouth. And so I think that actually step one for me would be just making sure that we factor that in as a priority. Even if it is 30 seconds, just get that baby to suck on your finger and see what it feels like. Talk to the parents about what you notice. And that's it.
Thank you so much. Oh, Joanna, it's been so nice talking to you. I can't wait for your presentation. Thank you for coming back here for two gold for our Gold Summer Learning Day 2025.
Looking forward to it. Thank you for having me again.
And some information for our viewers now. This presentation is part of this 3 presentation learning day. We have 3 presentations lined up for you on August 18th. And you can find out more information by going to goldlearning.com. And we all hope to see you at the learning day. Thank you everyone for watching. Bye bye
Thank
everyone.
you.
Bye.